Kia ora, my name is Dr. Morgan Edwards and I am an obstetric anaesthetist at Waitemata District Health Board in Auckland, Aotearoa, New Zealand. Being an obstetric anaesthetist is an immense privilege, walking alongside pregnant people and their whānau at this incredibly intimate and special time in their lives. When I think about what being an obstetric anaesthetist means to me, I think it's summarised by a recent situation where I had an emergency or crash caesarean section where there was some talk from the obstetricians of perhaps needing a general anaesthetic. Now, whilst we know a general anaesthetic is safe for both mother and pepe, it was the very strong preference of the whānau for them to be awake for the birth of their baby. And so, with the placement of a rapid spinal, we were able to facilitate that, which meant that mother was able to see baby being born, and by working alongside the neonatal team in theatre, after some brief resuscitation, baby was able to come and be on mother's skin for skin to skin, with some continued monitoring and a little bit of ongoing resuscitation, and ultimately baby was able to stay with mother. The fact that that whānau was able to be together for the birth of that baby in what was an emerging crisis was just such a wonderful outcome, and what makes being an obstetric anaesthetist incredibly rewarding. The College of Anaesthetists supports us in our training right from the beginning, whether it's learning about epidural placement or the physiology and pharmacology of the pregnant person and how that changes from the non-pregnant state, which enables us to make sure we're always delivering a safe anaesthetic to pregnant people, whether that's for non-obstetric surgery during pregnancy or when it comes time to having a baby. As an obstetric anaesthetist, I also completed a specialised obstetric anaesthesia fellowship at a quaternary centre, which enabled me to learn about the care of more complex pregnant people and then bring those skills to my daily practice as a specialised obstetric anaesthetist.